My name's Taylor. I'm an LCSW who works at the University of Utah in the neurology department. I mainly I see all types of people who are referred to me by neurologists, and a lot of that work is with individuals who have chronic pain, chronic migraines, headaches, things like that. And so the focus of my work is really to help individuals kind of assess for the biopsychosocial factors that can be contributing to their headaches, which we know that comes up a lot in our treatment, and that like holistic treatment of headaches and migraines is not just like medical intervention. And that's really important, because the assumption that it's all a medical issue only, and that there's only medical interventions would cause us to factors here. And if you're living with headaches and migraines, certainly you are probably very aware of this. But it's something that is somewhat new in like the medical community, just the acknowledgement that there's usually a lot of other things going on. And so a lot of my work is assessing for those things and then coming up with sort of solution-focused strategies for treating them and for addressing them. In the past, I've done a talk here at the Headache School on cognitive behavioral therapy, which is a really solution-focused therapeutic intervention that focuses on sort of cognitive reframing and cognitive restructuring. And what that means is typically, right, like you might have a thought that comes to mind, and you have certain feelings or beliefs about that thought, and it can cause like a chain reaction of additional thoughts and feelings and beliefs. And cognitive behavioral therapy would postulate that we have the opportunity to kind of recognize and understand what those thoughts are, and reframe them, restructure, rewrite the thoughts, and that doing so over time ultimately kind of improves our own like viewpoints, and changes the way that our brain sort of responds to certain situations, including pain. What I'm going to talk about tonight, however, is a different type of therapy called acceptance and commitment therapy, kind of a similar vein in that it deals with thoughts related. It deals with thought related work, but sort of from a different approach. And I found it to be really useful for a lot of individuals that I work with who are dealing with chronic pain. I want to just kind of pull up a little sheet here. Okay. So yeah, I wanted to show this image just because I think it gives like a good sort of visual of what I'm talking about. Acceptance and commitment therapy sort of functions on this belief system that we have thoughts and we have experiences and emotions. So for example, let's like take anxiety, for example. You right, have a thought or an experience that causes you to feel anxious. Maybe one approach to that would be to kind of like push the anxiety away, or to ignore it, or to try and distract from it, or to try and pretend it's not there, right? Like any myriad of different options. Acceptance and commitment therapy stands kind of on this foundation of the belief that in doing the pushing away and distracting and pretending that the anxiety is not there, we are in fact sort of inflating the anxiety. And the analogy that I like to use is if you've ever been around like a 7-year-old or like an 8-year-old, I feel like that's the prime age for when they really want attention from an adult. And so they might, right, like be pulling on your like jacket or sweater, like, pay attention to me, pay attention to me. Maybe you're on the phone and they're like trying to like, hey, I want to show you this, like, right, over and over and over again. And maybe you're on the phone and you're trying to just say like, hey, not right now, not right now. And the more you kind of try and tell them like, hey, I'm busy, right? The more they bother you. And so acceptance and commitment therapy would say any sort of experience, emotion, or thought that we have is like that 7-year-old kid. And the more we try to distract or push away or pretend that it's not there, the worse it gets, the louder it gets, until we finally like watch. And then like the kid wants to like jump off like a 1-foot like ledge. And it's like, see, wasn't that amazing? And you're like, yep, that was great. And then like the kid moves on with their day, right? So Obviously, that's easier said than done with more distressing emotions and experiences like chronic pain, like migraines, like anxiety, like depression. But that's sort of the foundation behind this type of therapy. And so to put this in the context of somebody managing like chronic pain or, chronic migraines and headaches, for example, we carry around a lot of thoughts and feelings about our pain. Obviously, we carry around feelings of distress and frustration. We carry around feelings of hopelessness. We carry around feelings of like this doesn't feel fair, or like I'll never be able to solve this issue. I'm going to live with this forever. And these thoughts can be like really, really heavy and really problematic, and really they can tend to kind of rule our lives in a lot of ways. And so what I wanted to share tonight, I know we don't have a lot of time, so what I wanted to share tonight is a really great technique that I do with my clients that I meet with, and it's called thought diffusion or cognitive diffusion, as you can kind of see from this sheet, little screen share. And what I want to talk about with cognitive diffusion is in this overarching theme of, okay, if we try not to just ignore our feelings, but rather just like acknowledge them and accept them, maybe they won't be as like intense or powerful. To do that, we have to practice recognizing that our thoughts are sometimes very, very powerful and often are the thing that kind of steer us around, right? I love analogies. Another great analogy for this is if you imagine driving in a car with like a really powerful thought or a really powerful emotion. If the really powerful thought or a really powerful emotion is driving the car, right, like they're in the driver's seat, you basically just go with them wherever they want to go, right? If you have the thought that like, I will never figure out a way to solve my headaches, I'll have these migraines forever, and that thought is driving the car, like you're just along for the ride, right? Cognitive diffusion is the process of acknowledging that thought is in the car with you, but how can we get that thought to sit in the passenger seat, or even better in the back seat, or maybe even better like in the trunk, or like back where the cargo belongs, right? How do we get into a place where we're not necessarily saying that thought doesn't exist or that feeling isn't real, but like, does that thought and that feeling need to be the thing that drives you around everywhere, so you're just kind of like feeling helpless and out of control? So one of the really great techniques to do this is something called cognitive diffusion, thought diffusion. The premises that one kind of accepts when we use this technique are, one, that our thoughts equal truth, that our thoughts are real, and that like everything that our brain thinks is truth, right? The next is that if I have a thought, I have to listen to what it says and I have to take it seriously. Anything that my brain says is something that is like important and serious and reasonable and needs to be like followed and taken seriously. And then the last piece is like, if I have a certain thought, because I'm taking it seriously, I have to like engage in some sort of action-based process in order to like follow through with the thought, or in order to like do what it says, right? And so like you can imagine that these three pieces, that thoughts equal truth, that we have to take our thoughts seriously, and that like we have to follow through with action-based like commitment, you can kind of envision that like no wonder the thought or the emotion is driving us around in the car, right? Now, when we experience any one of those three things, and often any of those three things happen all at the same time, what we say is that we are fused to our thoughts. So like our thoughts and our emotions are fused together. Our thoughts and the belief that they are truth are fused together. Our thoughts and our actions are fused together. As you can imagine, this is really applicable to anyone who's experiencing chronic pain, because any sort of thoughts around your headaches, around your migraines, like it's very hard not to feel fused to them. It's very hard not to feel like they are 100% truth. It's very hard not to take them seriously, because it is a real thing that you're living with day in and day out. But here's this little tip called cognitive diffusion is something that you can try and just see kind of how it changes your relationship with the thoughts around your pain. So as you can kind of see from this image, there's like these corresponding pieces of what, here's the first column, which is like when we're fused to our thoughts. And here's the second column when we're defused with our thoughts. Right. So it says like, not all thoughts are true, and that's okay. Accept your thoughts and take them lightly. And actions are based on goals and values, not based on like wherever the thought is driving you around. So I'll kind of pull these apart just a little bit more. The fact that not all thoughts are true and that's okay. That is a really, really tricky one for a lot of people to like grasp and understand, because our whole lives, like we're more or less raised with a belief system that everything our brain comes up with is true and worth paying attention to. But I want to give you an example of, how that might not be the case. Imagine you kind of went out to lunch with a friend and it was your favorite restaurant and it was whatever you ordered. You ordered a turkey sandwich. It was delicious. You finished the lunch and you are full, right? Like you cannot eat another bite. It's a regular lunchtime. So, like at some point, like you'll probably want dinner, but for now you are full. And that's your experience, right? You are full. You're not going to eat anymore. Imagine then you're driving away from the restaurant and you have the thought pops into your head, oh my gosh, like I love macaroni and cheese. I wish I could have some macaroni and cheese right now, right? This thought pops into your head. And if we were to accept every thought that pops into our head as truth, the next move you would make is to like drive to a place that serves macaroni and cheese, right? You like pull a U-turn and you're like, I need macaroni and cheese right now, right? Just because you have the thought, I love macaroni and cheese, or like macaroni and cheese sounds delicious, doesn't mean that you have to like pull a U-turn and like go find some macaroni and cheese, right? Like you have the ability to kind of cognitively override that thought and say like, like I do love macaroni and cheese, but I just ate lunch. So I'm not going to do that, right? Maybe I can have macaroni and cheese for dinner. Maybe I can have macaroni and cheese for lunch tomorrow. Or maybe I'm, not eating gluten. And like, even though macaroni and cheese sounds good, like I'm not going to eat it. Right. Now, this is an example of how just because we have a thought doesn't mean that it has to be true, right? Just because I have the thought that like I need to go get some macaroni and cheese right now doesn't mean that the thought is true, and it doesn't mean that I have to follow through with it. Of course, right, like what I usually get in response to that sort of comment or presentation is like, but like if I have thoughts about my pain, they are true, right? And my response to that is like, they might be true and they might not be true, but what I'm trying to introduce or what I'm trying to suggest is that there is a possibility that they're not, right? There is, and the point of this exercise isn't to like guess whether your thoughts are true or not true, or prove that they're true or not true. The point is to just kind of introduce some cognitive flexibility and get to the space where thoughts might not be true, or like, can we like not take our thoughts seriously every single time they come up, right? The next piece of just like accepting your thoughts and taking them lightly is sort of that same idea, right? It's like, yeah, I did have the thought that like macaroni and cheese sounds delicious. Like it's a thought and I'm going to move on with it. Right. And yeah, like there's no denying that I had that thought, right? We're accepting it. And we're also simultaneously accepting that like, just because like it is true that I had that thought, that's true, but I don't necessarily need to take it super seriously, right? Like I can just kind of move on with my life, right? The last piece is the actions are based on goals and values, right? And an example of this is I have the thought, that's true. I can choose whether or not to take it seriously. And then I can make a decision based on like what matters to me, which is like, I don't want to overstuff myself, or I don't want to eat gluten or whatever it is. And I don't have to just go get macaroni and cheese just because my brain said, hey, macaroni and cheese sounds good. And so we're making a choice based on like what matters to us, based on our goals, based on our values, not just based on whatever our brain decides to say. We have thoughts all the time that don't necessarily mean anything, right? And unfortunately, right, like as I'm talking with you all right now, I just had the thought of like a red balloon like floating through the sky. It's like, it's just a random thought. It doesn't necessarily mean anything. Thoughts can be like just sort of going on in our head at all times, sort of like a radio frequency, just kind of buzzing around back there. The problem is that when thoughts are distressing, we tend to take them more seriously. And so I'm not necessarily saying to all of you, like, your headaches are caused by your thoughts and your migraines are, better or worse because of your thoughts. What I'm saying is, like, we all have thoughts about our experience, be it whether our experience is I have chronic migraines, whether our experience is, I have an eating disorder, whether our experience is I have anxiety, and it can be helpful to identify what those thoughts are and kind of go through this checklist of, like, does this thought equal truth? Not necessarily. Is this thought something I need to take seriously? Not necessarily. Is this thought like helping me get to, like, ultimately the goal or the place that I want to be in? Not necessarily. So that's kind of the background. Here's the exercise. When you have a thought that is distressing or upsetting to you, I'm going to just use the example that I had with a client earlier today that I was working with. She has chronic pain and anxiety, and has a lot of distress around her symptoms, around her health symptoms. And anytime that she thinks about her health symptoms, the thought comes up like, I'm never going to have a solution to this, or I'm never going to be able to figure out what's wrong with me. I'm going to always be living with this pain. We talked about this really specific diffusion technique. Imagine yourself saying, I'm never going to be able to live without pain. And just sort of notice for a second. And so, yeah, I'm just going to give pause for just a second and allow you to say that out loud to yourself. I'm never going to live without pain. And just kind of notice how intense that feels and how hopeless that feels and how kind of overwhelming that feels. And this is what I did with my client earlier today. We just kind of paused and noticed, that feels very true. It feels very intense and overwhelming. Now, I want you to take that same thought, but I want you to add one small little phrase to it just before. So we have the thought, I'm never going to be able to live without pain. And now just adding this small phrase of, I'm having the thought that I'm never going to live without pain. And just notice how and if that thought feels different to you. And kind of why it might feel different. I'm having the thought that I might never live without pain. Most people, when they add that little piece in the beginning, will point out that it does feel different. And they'll point out that maybe it feels different because there's a little bit more, the thought doesn't feel as true. When I say I'm never going to live without pain, or I might never live without pain, that feels very true and intense. But when you add that little kind of preamble of I'm having the thought that I'm never going to live without pain, it sort of gives it a little bit of space. It doesn't feel like a statement of truth as much. It doesn't feel like, right? It doesn't feel as heavy. And that's a great example of thought diffusion and how we can take even just a simple few words, add them to this specific phrase and just create a little bit of space. Now, again, it doesn't necessarily have anything to do with whether that's true or not true, right? We don't know if one person will ever live without pain or not. Nobody can know that. No doctor can know that. You can't know that, right? This has nothing to do with the truth of the actual statement. This just has everything to do with creating a little bit of space between the thought itself and your own experience with it. And in doing so, hopefully, right, allowing yourself to take a step back and then allowing yourself to not to step into the driver's seat and to drive the car around rather than the thought and the feeling driving the car around. There are some other great diffusion techniques. So I always love, I'm having the thought that, and I always encourage my clients to practice that, starting out 4 or 5 times a day. Anytime you have thoughts that are distressing to you, I'm having the thought that I should go have some macaroni and cheese for lunch. Interesting. I'm not going to do that, right? I'm having the thought that I might always be in pain. That's an uncomfortable thought. I don't really know what to do with that, but I'm just going to sit here and notice it for a while. And if one does, you might notice that it doesn't last forever, et cetera, et cetera. There's some other ways to do it. I have some clients who really like to imagine their own thoughts in like somebody else's voice, like a cartoon voice or just like a silly voice. When you take something like I'm having the thought that, and you change it to like that, I might always live with pain. Like that's a pretty like weird and silly thing, and creates a little bit of separation. And just like, again, this thought doesn't necessarily have to be as serious and true. I have some people that will sing their thoughts, right? Like sing, like I might always live with pain, and like a sea shanty tune or like some other kind of weird, silly tune. You can imagine like a newscaster broadcasting like this just in, like I might never live without pain, or just, anything in that. Imagine a famous actor saying it, whatever. I have one client who really loves to imagine like her like intense distressing thoughts like written out on like a birthday cake. In fact, one time as like sort of an intervention, she baked a cake and like decorated it with like one of her scary thoughts, kind of distressing thoughts, and was like, wow, this is like pretty weird that like this thought's now on a cake. So those are just some places to kind of some ideas and some ways to practice some of this thought diffusion. There's a lot of other strategies, and thought diffusion is just kind of one part of acceptance and commitment therapy, but it tends to be a really effective one for the people that the people I'm working with, the patients I'm working with, in managing kind of some of those very highly distressing thoughts around their pain. So that's kind of what I wanted to touch in on about today. If you have additional questions about ACT, which is short for acceptance and commitment therapy, or just generally kind of the relationship between pain and our emotions and our thoughts and experiences, you are welcome to reach out to me. You're welcome to reach out to your provider and request like a referral with me. I'm happy to meet with anybody who's being seen and treated at the University of Utah. And that's kind of what I do all day is therapy and just providing that extra emotional support, because everything that you're going through is overwhelming and hard and stressing, and sometimes it's just really difficult to do it alone.